students, I welcome you all for the Ardent MDS. This is one of the very important topic and expecting topic in your exam. So there are so many videos available in YouTube for related to the COVID-19, but there are very few videos available which is relating to the dentistry. So this particular session which explain you about the relation between the COVID-19 and dentistry, and you can expect some multiple choice question from this particular topic, right? So to start with the first question, all are true about SARS-CoV-2 except. What is the full form of SARS? That is severe acute respiratory syndrome, which is caused by COVID. The first option is about they are zoonotic in nature. Is it right? Yes, it is right. They are zoonotic in nature. So initial contact of people in China, they had some relation with the seafood market in Wuhan. They believe that it is a zoonotic in nature. And coming to the second one, 5 known CoVs are in humans are present. Is it right? No. There are 6 subtypes of COVIDs present in humans, so which I will explain you later. And the third one, males are more frequently affected than females. Yes, there are 60% of males and 40% of females. Till now the data is collected. And number fourth one, nature of the surface alters the persistence of the virus. Yes, the virus which persists on the surface for few hours to some days. Suppose for an example, if you take in stainless steel it stays up to 2 days, 2 to 3 days even. And copper it stays just 4 hours. And in case of cardboard it stays only for 24 hours. The fourth option also right. Coming to the second option, there are 6 subtypes of COVID which present in human being. So among this, number 1, SARS-CoV, that is number 1, and number 2, 229E, and number 3, OC43. This is the third type. And number 4, this is the fourth type. And number 5, HKU1 type. And number 6, MERS-CoV. So that is Middle East Respiratory Syndrome. So these are the 6 types of COVIDs present in the human. So it is not necessary to read all these things, just know there are 6 subtypes of COVIDs present in the humans. And you have to know the MERS, that is Middle East Respiratory Syndrome, and SARS, that is Severe Acute Respiratory Syndrome. Right. So coming to the second one, what is the most common symptoms of COVID-19? Yeah. So most of the patient have symptoms of fever. Around 88% of patient have fever. So answer for this is fever. And there are some patients which have cough and dyspnea. So around 54% of patients have cough and 45% of patients which have some amount of dyspnea. What about dysgeusia? Dysgeusia is altered taste sensation. But there are some few patients in COVID-19 who has loss of taste sensation and loss of smell. So loss of taste sensation which is called as ageusia, and loss of smell which is called as anosmia. Anosmia and ageusia are present in some of the patient. Right. So question number 3. All are categories of triage of dental category during COVID-19 recommended by American Dental Association except. So what is called triage? Triage is separate the patients according to the treatment level they need. So that is triage. So these are the 4 categories which are given, but according to American Dental Association they just divided into only 3 types. That is emergency care, urgent care and elective care. There is no subtype called as immediate care according to the AD. Right, what is emergency care? So emergency care is the patient who have some problems which may impair the breathing. So these type of patient you have to be taken very immediately as possible. So that is called as emergency care. And second one, that is urgent care. So in urgent care the patient have a severe pain. So that type of pain which increases in time, and there is the pain which is having score more than 7. So, and this affect the normal functioning of the patient. So that will come under urgent care. So look like both are synonymous with each other, emergency and urgent care, but both are different. Emergency care, which you have to be as immediately as possible, you have to take care of the patient. Okay, but urgent care you can give some amount of delay, but you have to treat those type of patient also. So this is urgent care. And third category, which is delayed urgent care, and the fourth category, which is called scheduled care. So scheduled care, which is otherwise called as elective care. So those type of patient who does not have any pain, loss of restoration. So this endodontic access cavity without any filling. So that will come under scheduled care. No pain. So these type of patient you can treat it later. Okay. So but all this, the third type, that is delayed urgent care, emergency care, you have to be treated, but you have to give priority based on the treatment or based on the triage. So what are the examples for emergency care? Number 1, uncontrolled bleeding. And number 2, diffuse intraoral or extraoral swelling which may obstruct the airway. And number 3, severe traumatic injury of the facial bone, again which affects the breathing. So these are the things which will come under emergency care. And coming to the second category, that is urgent care. So urgent care is just the patient who have an apical periodontitis, symptomatic irreversible pulpitis, pericoronitis with associated abscess. So those type of patients who have severe pain, so they cannot do the normal things or normal functions, it will come under urgent care. Right? So coming to this, so all are categories of triage of dental category during COVID-19 except immediate care. There is no category called as immediate care. Right, coming to the fourth question, an example for the urgent care during COVID-19 in dental treatment are all except. Right, so first is emergency, the second category is urgent care. So urgent care you can make some delay, few delay. So coming to this, symptomatic irreversible pulpitis. Yes, it come under urgent care. Patient have severe pain. Dental trauma with abrasion. Yes, it needs treatment immediately. Symptomatic apical periodontitis. Again symptom, patient have pain. The fourth one, traumatic injury which can obstruct the airway. So because it obstructs the airway, you have to be treated as immediately as possible. So it falls under emergency care, not under the urgent care. So the question all is about urgent care. So this does not belongs to the urgent care, it belongs to the emergency care. So it can go for the fourth option. Right, so coming to this. So what is the recommended medication for emergency care patient? So during pain, suppose in case the patient is having severe pain during COVID-19, in case of telemedicine or teledentistry, what is the treatment can be, or what is the medicine you can prescribe for the patient for pain? So number 1, acetaminophen 1000 mg, ketorolac 10 mg, pyroxicam 20 mg, all of them. Yes, you can give any type of drugs or any of the above drugs. Even you can give even ibuprofen for the treatment of pain. Right. Coming to the sixth question, a very important question, a tricky question for you. According to the CDC, Center for Disease Control, that is the full form of CDC. They may ask you abbreviation type of question also for you. Social distance to be maintained. There are two type of theory here. So according to WHO, they go for 3 feet. They go for 3 feet. But according to the Center for Disease Control, it is 6 feet. So remember both the things. According to the question they asked, just answer for the question. So in case sometimes they may ask you in meters instead of feet, they may ask you in meters. 3 feet is equal to 1 meter. 6 feet it is equal to 2 meter. Right. Why they are telling or why they are keeping 6 feet as far as social distance? In case if the patient sneezes, so the droplets can go up to 6 feet distance. So that's why they are just maintaining it 6 feet. In case if the patient cough, okay, it just go up to only 3 feet. Okay. In case the patient is breathing, mouth breathing, so the droplets will go only 1 meter. So based on this, they are just maintaining 6 feet for the social distance to be maintained to control the COVID-19 or spreading the COVID-19. Yes. Question number 7. Respirators can be used safely with their specification for up to. They are asking about how many hours you can use the respirators. Example for the respirator is N95, N99, all this belongs to the respirators. There are 2 types. Okay, number 1, normal mask, and number 2, respirator type. So normal mask can be wear up to 2 hours, but respirators can be worn up to 6 to 8 hours. Okay, if there is no contamination, no blood, no fluid, no spoil, so then you can use for 6 to 8 hours. Right. Filtration efficacy of N95 mask. What is 95 belongs to? Very easy. 95 belongs to 95% of filtration. But what is N? They will ask you. In case of N95, you can tell 95% filtration. Right? But what is N? N is not resistant to oil. Right. Similarly, there are one more type of mask which is called as N99 and N100. Right. So N99 has 99% filtration and N100 has 99.99 filtration. 99.99 filtration. So this is not resistant to oil. Then there is something called resistant to oil. Any mask? Yes. There are some masks which are resistant to oil. What are those masks? R95, R99, or some of the masks which are resistant to oil. R is somewhat resistant to oil. And there is one more type of mask which is P95 and P99. So those type of masks are completely resistant to oil. So there are 3 type of masks. N95 is not resistant to oil, R95 which is somewhat resistant to oil, P95 which is completely resistant to oil. Keep in mind this. About 95, 99 you can know, right? And what are the step-by-step procedures of donning and doffing of personal protective equipment? Which one you have to wear? Mask first or gloves first or gowns first? Which one? Okay, right. They may ask you this type of question in your exam. So I just go through the simple video. What I am going to say is about. Okay, and you can able to answer for any type of question. Right. What about? Did you see the video? What are the step-by-step procedure? Yeah, the first procedure, when you just before entering to see the patient, you have to do the hand hygiene. So this is the first one, right? So this is the first one. And coming to the second one. Once you've done the hand hygiene, then the doctor wearing the gowns, right? So this is the second one. Sorry. Hand hygiene is the first one. Yes. And once you've done the hand hygiene or cleaning the hand with alcohol based disinfectant. What alcohol is used for this? 70% alcohol. Pure alcohol does not act as disinfectant. Right. Then put on the gown. Okay. Once she done the gown, then she went for mask. Then eye protection. Then finally she wearing the gloves. So this is the step-by-step procedure for donning. Donning is just before you have to see the patient, order of the arrangement of the personal protective equipments. Once you completed the procedure, okay, then you have to go for a procedure called as doffing. What are the step-by-step procedure of doffing? So again we just continue to see the video. Kindly go through this video. What are the doffing procedures, step-by-step procedure? So first, what she done? She removed the gloves. Then she removed the gowns and hand rub was done, and followed by she removed the eye protection. Then later finally going for she removed the mask or respirator. Finally again hand hygiene has been done. So this is the step-by-step procedure for the doffing. Right. So now tell me one by one. So what are the step-by-step procedure of doffing? Right. Number one, first step, she removed the gloves, right? Then she removed the gown. She went for the hand hygiene. Then she went for remove the eye protection. And finally she went for remove the mask. And finally one more time she went for the hand hygiene. So these are the step-by-step procedure for the doffing which you have to know. Right, coming to the next question, which is not an ideal mouthwash for pre-procedural rinse. During COVID time, pre-procedural rinse which is recommended by CDC and WHO. So before you starting treatment for any patient, so you have to ask the patient to go for rinse the mouth with some disinfectant solution, right? So which is the most effective among this? Okay, for COVID-19, hydrogen peroxide, which is more effective, but you can use also povidone iodine, but chlorhexidine is not very effective in COVID-19. Okay, so either you can go for a hydrogen peroxide or povidone iodine, but chlorhexidine does not effective. So answer for this is chlorhexidine. Not an ideal is chlorhexidine. But what you can do is, once you completed the hydrogen peroxide mouthwash, then ask the patient to do chlorhexidine, because chlorhexidine has substantivity property. Substantivity property is disinfective property of the chlorhexidine will remain for some time there. So, but chlorhexidine does not very effective against COVID. Okay, so first thing is you have to go for hydrogen peroxide, then only you have to go for chlorhexidine. For this question you can go for chlorhexidine, right? And what is the time period between patients for non-aerosol procedure? So between every patient which entering into the dental clinic, you have to give some break time for the fresh air to enter. Either you can use exhauster to remove the air, or something called as HEPA, high efficiency particulate air, which filters the microorganisms along with the air. So, but anyway, you have to wait at least 15 minutes between any patient in the dental clinic for non-aerosol procedure. Suppose, in case, if they ask you what about aerosol procedure, for the aerosol procedure, you have to wait at least for 30 minutes. For aerosol, you have to wait for 30 minutes. Right, question number 13. Hand hygiene to be done after which procedure? Is before the patient examination, you have to do the hand hygiene. So for a hand hygiene, you can use two techniques. Either you can use soap with water, or you can use alcohol based hand rub, that is ABHD, alcohol based hand rub. So when you can go for soap with water, when you can go for alcohol. Okay, in case if your hand is soiled, then you can go for soap and water. Not soiled, then you can go for alcohol based hand rub. So examining any patient, before that you have to go for hand hygiene, yes. Before any dental procedure, yes. If the gloves are torn, yes, immediately you have to go for hand hygiene. After removing the gloves, yes. So you can go for all of the above for this particular question. Right. Question number 14. Which interleukin is more common in pneumonia type of COVID-19? There is something called as cytokine storm. There is something called as cytokine storm in COVID-19. Mean more amount of interleukin is releasing. There is inflammatory mediators which cause more damage to the lungs. So we have to control those inflammatory mediators. Okay, further we are giving some better antibiotics for the patient of COVID-19. So both interleukin 1 and interleukin 6 both are released in case of COVID-19, but among this, which is the most common, if they ask you, interleukin 6 is more common than interleukin 1. So you can go for the second option. Right. And medical masks should filter at least particle size of 1. Medical masks, they are talking about N95 type of mask or FFP type of mask. So it filters around 0.3 micrometer also. So answer for this is A. And what is the abbreviation FFP2 for? What is FFP? FFP is filtering phase piece. So there are two standards for the respirator. One is N95 type of mask. FFP is one more type of mask. Right. N95 type of mask is standard of US, and FFP is a type of European type. Right. So in case of European type, there are three FFP: FFP1, 2, and 3. What is the filtering capability or efficiency of FFP1? 80%, 94% and 99%. Again, let me ask you in one of the exam. So what is the filtering efficiency of FFP1 or FFP3? Right, percentage of alcohol act as a best disinfectant. Just now we discussed 70% of alcohol which act as a best disinfectant rather than 100%. Which UV light has the best disinfectant property? There are three types of UV light, A, B, C. Among this, C has higher penetration power and they have more disinfectant property than UV A and B. According to the EPA, that is Environmental Protection Agency, the DUVWL. What is DUWL? They may ask you in abbreviation. Dental unit water line. So the dental unit water line, that is which connecting your patient sink to the water line, the water which carrying the pipes, all these things should have some colony forming unit, right? But this colony forming unit should be less than what level? You have to maintain the colony forming unit less than 500. Clear? And basic reproductive number of COVID-19, one number of case which may reproduce into or which may spread to how many cases or how many peoples. It may 2.6 to 4.7 and this numerical value may change. So at the time of taking the question, so the value is given as 2.6 to 4.7, mean one patient can spread the disease to 2 to 4 patients. Right, these are some of the abbreviations you have to know. So starting from the first one, CDC, that is Center for Disease Control, and AGP, that is Aerosol Generating Procedure. PPE, Personal Protective Equipment. DUWL, Dental Unit Water Line, where the colony forming unit should have less than 50, right? And ACH, ACH is air changes per hour. Okay, I mean air changes per hour is like you have to wait how many minutes before you call for the next patient. That is air change per hour. You have to wait 15 minutes for non-aerosol procedure and 30 minutes for non-aerosol procedure. HEPA, high efficiency particulate air filtration. Right. So next, what is HICPAC? HICPAC is something look like your Center for Disease Control. HICPAC is healthcare, I for healthcare, I for individual, and C for healthcare. Case fatality rate of COVID-19. So what is called as case fatality rate? Case fatality rate is the number of death for the number of cases. It is called as case fatality rate. So case fatality rate for COVID-19 is 2 to 6%, but in case of MERS, that is MERS, Middle East Respiratory Syndrome, the case fatality rate is too higher when compared to the COVID-19. So it is around 30 to 35% in case of MERS. For COVID-19 it is 2 to 6%, comparatively less than your MERS. But in India approximately we are telling about 3%. Coming to the next question, the first case of COVID-19 reported in China. So it is about 1st of December, first case which is reported in China from the Wuhan market. What is the first date of the COVID-19 reported in India. So it is 30th of January, right? And what is about 11th of March? Is there any special? 11th of March, WHO officially said that COVID-19 was a globally pandemic. So there are 3 dates which you have to be remembered here. So 1st of December, the first case which reported in China. First case in India which reported in 30th of January. And WHO announced this COVID-19 as globally pandemic in 11th of March. What are the mode of transmission of COVID-19 are all except? Yes, it is spread by droplets, right? And it spread by the contact, yes, and it also spread by fomites. What is fomites? Fomites are inanimate objects like towels, toys, even your pen. So which transmit the microorganisms from one person to another person. So fomites also transmit the COVID-19, but there is no report that bloodborne transmission occurs in COVID-19. So except they are asking, so you can go for this bloodborne, right? The types of epidemic shown in the COVID-19. So COVID-19 type of epidemic. What is epidemic and endemic? Epidemic is sudden outburst of disease, right? So initially the COVID-19 was epidemic, later it became pandemic. So what are the type of epidemics seen in COVID-19? So it is a point source epidemic, yes, either a single exposure or multiple exposure, or it is a propagated epidemic, increased day by day. Yes, all these are which occurred in COVID-19, so you can go for all of them. Most commonly used disinfectant in containment zone. So sodium hypochlorite is the best effective antiviral, especially for the COVID-19. So mostly the containment zone, they just spray the sodium hypochlorite to prevent the spread of the infection. So you can go for 1% sodium hypochlorite. Right. What is the application which given by the government of India for tracing the COVID-19? Okay, and you all know this is an easy question. It's Arokya Sedu. Just given for some fun. And so Arokya Sedu, which this application you have to tell your information, and those people who are surrounding you, they also registered this application. They given their information. So you can know how many of you are surrounding people have an infection. So for a safety precaution you can take easily. So this is the use of this mobile application called Arokya Sedu. And duration of quarantine for the COVID-19 after onset is around 14 days. Yes, once the symptoms are appeared, you have to be for a quarantine for at least 14 days. And all are true about Kavach. So except this Kavach is a type of antibody kit which is given by the ICMR and National Institute of Virology, Pune, and it is not used for diagnose or confirmatory diagnosis. Until now, RTPC, that is a real-time PCR, is the method which is used in India for the confirmation. So diagnosis of virus or confirmation of virus, you cannot use this Kavach kit. So this Kavach kit, which is a type of kit which even detects this virus within a 130 minutes of incubation. And it is used for surveillance purpose. Yes, it detects the IgG antibody. Yes, so all these are right. Except the fourth option, for a confirmation of virus, you have to go for RT-PCR. And the last question, what are the steps of hand wash? So probably this is one of the questions we can expect as a examiner. So he or she can expect that every dentist should know the steps of hand wash. So at this particular time, these are the steps of hand wash technique which is given by World Health Organization. Right, we just see one by one. So the first step after applying the soap and water, the first step is about palm to palm, right? And second step is about, so palm to back of the hand or fingers, then fingers interlaced like this, finger interlaced, then interlocked fingers like this, then interfaced, interlocked, then you have to be like this, this is an interlock, then rotate the thumb finger, right, clean the thumb finger and rotate the tips of the finger to clean the nails. So these are the step by step. I just repeat one more time. Palm to palm, palm over dorsum, second step, and palm to palm with the fingers interlaced, then interlocked, then clean the thumb finger and clean the tip of the finger. Okay. Still for a better understanding, okay, just put you some videos. Just go through the video, then we can go for the question. Now come to the question. Now can you be able to tell step by step process of hand wash technique? What is the first step? Palm to palm, right? So this is the first step. Sorry. This is the first step. Second, palm over the dorsum. Yes, then interlace, palm to palm interlace, and fingers interlocked, right? Then rotational rubbing of thumb finger, 5. Then rotational rubbing of the tip of the finger, 6. So these are the step-by-step process of hand wash. The must question you have to know. So hopefully you enjoyed this video and you learned many points. So probably this may help you in exam. So thank you for watching. Have a nice day.